But the thing that could have prevented some of this headache here would have been if we would have got her father a good the health insurance plan. It would have been good. Like right now, I'm looking at the MetaCard VIP plan suite, where the maximum benefit is 700,000. You get 20,000 accidental death. It's I'd say a little more, about $110 a month, and that's what I'm gonna get for me, Kay, and also her mother. So if something like this happens, with one of us, and that's why insurance is important, because you think for that price, that's pretty much close to the price in the states, paying that much. I'm sure in the states, some people paying like 400, 500, depending on their conditions, but that's still kind of high when you compare it to the states at $110. But me and Kay are gonna get it for me, her, and her mother though, because it's something we need. Something. If a situation like this comes up again, we're not scratching and searching, because right now, with everything going on right now, we're gonna have to pay all this out of pocket, which is a lot more expensive. But can't let this happen again, man. Sometimes it takes something serious to happen for you to realize um, what you should have. And don't get me wrong, her father, he does have insurance, but it just doesn't cover enough. His health insurance, just doesn't cover enough. So that's why you definitely want to be prepared now, to where, say, if her mother bumped into the same situation, that she doesn't have to go through the same thing that's happening right now with her father. So definitely we're gonna get her mother on the plan. Me and her are gonna get one, even though we may not need it. You just never know. You have to make sure you have insurance in the Philippines, even as a foreigner. So that's something I will definitely be taking care of. Kay's gonna do it. We're gonna do this immediately. Right now we're doing we're still doing our 30-day challenge. Also, I got to get back to the videos on that, but we're doing our 30-day challenge. We're gonna be fasting, and also we're going to be going on the vegan challenge next month, where we cut out all meat, even fried foods. We won't be doing any fried vegetarian foods. It's time to really make a change and even introduce these things to our family. Because prevention is the best cure. You don't have to worry about getting disease if you prevent diseases before they even come. So that's what it's about now. It's preventing and helping out the family with being healthy. So that's what it's about now. Now, when I was first learning, when I first learned about the Bible, hey, what's going on, Sean? When I first learned about the Bible, and I never seen the Bible like this before, I started studying the Genesis, and the health message, and it teaches, exercise, it teaches a proper diet, it teaches all of these things. It teaches you need enough sunlight, it teaches you need proper rest. In which I felt that these, I say past 2 days I haven't got proper rest. So I got up today and I was feeling pains all over, mixed with the stress too. Feeling pains all over my body because I haven't slept right, or I haven't gotten proper sunlight. These things do affect us. So yeah, guys, definitely if your parents are still around, talk to your parents about being healthy. I have to talk to my father and mother as well. You know, um, my father has diabetes right now. He's in the U.S. And the one thing that got me with him is I remember one day there was no food in the house, right? And I was staying there briefly for a couple of months. There's no food in the house. The only thing left was my food. So when that happened, he goes inside the fridge, and I was full vegan at the time. And he starts eating my vegan burgers and the different things I have. And then I said to him, I said, "Why do you eat my food when there's no food?" But then, when you get your money again, then you're gonna turn right back around and go eat sandwich meats and all of that stuff. I seen the Medicare VIP plan suite, which is that's 5,500. That's the most expensive one out here in the Philippines. You know, and also too, I wanted to jump on live to what live is doing right now with me is you know help me feel normal again. You know, and K as well. Oh yeah, I moved out now. Is my connection good, Sean? Then I deleted that last live totally. I don't want people to think we're begging for money. That's not what we're doing at all. You know, we just really looking for a specialist so we can pay them. You know. Oh, I'm in Pasig. I'm currently in Pasig, Chris. That's where we're at. I'm currently in Pasig. But no, definitely, especially you know, guys that's expats and that's looking to come stay here because you never know. You know, you could be somewhere on an island, surfing, you know, smash into a rock, and you're totally just out of it, can't do anything. You know, and then you're in a hospital, you can't make it to a private hospital because the hospitals here, you know, if you don't have that insurance or the money to pay it right away, uh, they'll kick you out the door. You know, it's not like in U.S. or some other countries where all are welcome. You know, if you don't have insurance or you can't pay that cash right away, they will open the doors and tell you, sorry, we can't take you. You know, unless it's a one of those public hospitals, but the public hospitals they're gonna cater to the people that are from here first. So if you don't have cash on you, you know you can't come into some cash somehow, or you know you have nobody that can send you some cash, or anything like that. You're out of it. You know, I remember I got sick. I remember I got sick. Yeah, that's right. You gotta have that backup money. I remember I got sick and I went to the doctor. You know, and it blew my mind. I said, okay. They checked me, and I had cash in me. I had a lot of cash in my pocket, but I was shocked. You know, they was like, oh, they had my bill ready, and I was like, whoa. You know, it really shocked me. I made a video about it actually a while ago. But I'll definitely make another video about it because you know we're going through it now. But yeah, if you don't have that cash on you or you don't have some kind of insurance, and they do have insurance for expats out here, um, yes, that's right. Set aside monthly medical stipend as if you were paying for medical in the U.S. You have to do that when you're here. You have to because it's more strict here, and you definitely want to go to a private hospital. That's right. If your health is bad, the PI ain't for you. There's no 911. They do have you have to you can call someone, but you have to know the ambulance number. You know, you have to know where you're at. Like when you go travel there, you have to go. Okay, you know what? What's the ambulance number in this area? Because like you said, you can't just pick up your phone and dial 911. You know, no one's gonna answer that. So you will have to have whatever area you're going to, whatever medical numbers in that area. Because if something happens, you know you're screwed. So you definitely want to be prepared. And there's also different expat insurances out there. I don't get into those. Me, I'm gonna be getting regular insurances. They do have regular insurance here for expats too. I think it's Pill Health and a couple other things, right, Kay? Takes foreigners. I forgot what company it is, but me, I'm married, so you know I'll be like a permanent resident here, so it's no problem for me. Pacific Blue Cross has affordable policies with great coverage. Okay, you know, but definitely you know, you're traveling, you want to have insurance that's wherever you're going to, that's going to work, and especially in the Philippines, because Out here, everything goes on the Philippines time. I really truly see what Philippines time is dealing with the situation with her father. Philippines time is in the situation with health. Philippines time is, it doesn't matter if this is a situation, life and death situation. That person that cut off his pinky toe playing around in the backyard, if he's here before you, he goes before you. And that shocked me actually. I said, wow. I said, I really see how it is. Because that's what we're dealing with right now. We can't get her father the proper care. We can't just turn around and just jump up and change hospitals and put up, millions of pesos. That's how much it costs, and it's really a situation like that. But yeah, you definitely have to have that insurance. So that's what we're going to. We have to do it for a mother. We have to. It's no even if ends or buts about it. We have to get her mother some good insurance. She's at that age where she needs it. And I just don't want my wife to go through the situation again. I don't. I don't want one of you guys to do that. I wouldn't wish a situation like this on my worst enemy. You know. So definitely get yourself some insurance. Definitely make sure you're safe. You know, I know a lot of guys are. I know a lot of guys are adventurous. So if you're an adventurous person and you're coming here to go kayaking and surfing and you're going mountain climbing, you definitely want to make sure you have some insurance when you come to the Philippines. Me, I'm not into all of that. I'm not a surfer. I'm not one of those guys. I feel like when you do that kind of stuff, you're putting your life on the line. No, no, Chris. He's not stable. He's in a coma right now. He's in a coma. So, Chris, if you happen to know someone, that know a neurologist out here that we can pay out of pocket, that had an office. We look for someone that has not an office but their own practice, that we can take them from an ambulance, there to get checked up, and then bring him back to the hospital, and then they can begin working on him. That's what we're looking for. A neurologist that has a practice that we can go to that's in the Pasig area. All right, see you later, Sean. And thank you guys for being supportive. My wife is really feeling it right now. She has to be strong. When she's at the hospital with her family. So when she's home, sometimes she just breaks down. You know, it's hard, man. It's hard, and it breaks me down too. Because I have to be strong for her. So I haven't been functioning right in the past 2 days. Being up there, seeing him like that, knowing, man, there's nothing I can do. You start to blame yourself. You start to blame yourself because, like, man, if I would have put away more cash, kind of thing. If I had 200,000, in the bank, it wouldn't even be an issue. Which I believe everyone should have. You should be saving. You should be saving. You should be saving most of your money and spending maybe only 25% of the money. You know, that's how it should be. And this makes me truly feel it. And now I'm really gonna be saving even more harder, because when they say put something away for a rainy day, that's so true. That's so true. You have to put something away for a rainy day. You never know who's gonna need it. A situation happened where a situation could happen where like what happened now, or something could happen where you may have a family member that may be in a dire need and really be in that need, and you can't do nothing about it. You just can't do nothing about it, and that's really serious, man. That could really It can really have you feeling guilty, you know. It can really have you feeling guilty, going, man, I have the opportunity to do this, but I didn't do right by that opportunity. I didn't plan accordingly. You know, I didn't plan accordingly. You know, I feel like I'm what, gonna be 37 in June. You know, I should have 250,000. I should have $1 million laying around in U.S. cash. You know, so now it's that really makes you think about life and go, you know what, maybe I need to change my life around even more to to make this happen for not myself but others around me. You know, also seen when I was in the hospital, right? I noticed, and it made me think about just the Philippines in itself, and I felt bad because I'm like, imagine, you know, the people that are poor, out, you know, and a lot of people that were poor were going to that same hospital, and there's nothing they can do, you know, like the family's sick, and like it's really nothing they can do. It's really, you know, they don't have anything out there. But I don't know. To me, the best thing is prevention. I can't help but think, you know, we could have worked harder on that, you know. And let me stop talking like that because my wife hears me, so I don't want her to think like that. She's already feeling like that, you know. But um, you know, it's true though, man. I see, and I think about all the other people out there that are, they don't even have what me and Kay have. They have nothing, and they can't get any help if they get sick. You know, they, the people that are poor, you know, you gotta think they family gets sick, they gotta keep them home, and they just they die right there, man. You know, that's why I gotta get more into you know, the health message, and finding people out there that's maybe in need. And also it starts with family, my family here too, my family even back in the US. But it's find people in need, and you know, and learn more about the foods, because there's foods and so many different things that can heal people. Like when Jesus was healing people in the Bible, he was using herbs and he was using natural things that actually do heal. You know, and I know you guys hear a lot about that now. People being healed with herbs and different things. You know, and prayer and mixed with herbs, and there's many different techniques out there that really work. You know, that's good, Sheree. That's what it is. You mostly you're 90% vegan. You know, and man, we gotta go. We actually need to go. I think everybody needs to go fully vegan. You know, and I think it's really time to push that. I really want to push that for people in the Philippines, and people all over, because especially out here, you know, like for instance, they have the salty fish that people eat. You know, that's the worst thing. You know, that's the worst thing. They also have a lot of foods out here that are extra sweet, and oh, Yellow Mall. Okay, I used to live over by that area. Well, not live over there. I used to be over there a lot in the Yellow Mall. You know, and also too, and I want to go over there too, and I'm gonna do a vegan tour, Sheree, where I'm showing the different vegan restaurants out here in the Philippines. That's what I want to start doing. When I looked it up, it's a lot of vegan restaurants out here. You know, you just have to find them and get there. You know, but it's not so many people that have their when Kay's father used to go to this place where you go to like get help from the government. There was so many people there that weren't healthy. But if they just change their diets, see, when you get to the point where you need, when you get to the point where you need like to get as bad as her father was in dialysis, that's when it gets worse, and then that's when you really can't do the like a healthy diet anymore with healing foods, because now you're getting dialysis, so you have to go by what the doctor says. But before that point, before it gets that bad, you know, food actually does heal. And yes, Sheree, I would love to connect with you. Maybe we could do something together where, you know, We reach out to people that don't understand healthy living. You know, I'm looking to connect with people on that because what's killing people mostly, especially in the U.S., it's even worse. But it's here too. You know, there's people overweight here. I see them. I see people here that look just like people in the U.S. You know, extremely unhealthy. You know, you see them at the hospital. Those are the same people you see in there. I was in there and I'm like, oh man, I'm looking at all these people. And I'm like, if they just tried a little harder and worked on changing their diet and doing certain things like that. And I'm not trying to point fingers at them because I need to do it. But right now, I'm working on it with Kay. I'm working on it with Kay. We're changing our diet. We're changing our exercise habit. We're changing everything. The way we're living. I didn't I didn't come here to the Philippines to do the same things I did in the U.S. I came here to stay away from trouble and to also keep my body healthy. And to find God and find a purpose, find a purpose in life. And I appreciate you guys for watching, and that's what I want to do too. That's why, if you guys notice, I'm changing my videos around a little bit. You see that? Sheree says she survived cancer from eating healthy. American food is garbage. And it's true, and that's what I want to show. I want to show the healthy living. I want to show how people need to exercise. I think I need to make the videos more interesting, my exercise videos. It seems like I bore you guys to death with the videos because nobody watches them. People don't really watch them anyway. I'm not in the health fitness area, but I do want to, be there and to promote healthy living and also show the beautiful Philippines too. You know, there's so much that we can all do with our YouTube channels. To put out a positive message. And I think healthy living, that right there, and healthy eating is, that saved the world. It definitely saved the world. Well, nothing is going to save the world but God, but you guys know what I mean. It can definitely help out, help some people turn their lives around. And thanks for the blessings and prayers, Homer. We definitely need to talk, man. I like your new YouTube channel too that you got. Guys, check out Hanging with Homer. Yes, Sheree, I used to go in. Me and Kay actually used to do. We used to go in Facebook groups, right? And we used to actually promote an Vince's brother. What he does. Get up and stop talking. Actually do it. Plus you. Yeah, exactly, Big O. That's the thing, and that's what I said with Kay. I told Kay that I didn't want to go too hard on pressuring her, but I said, babe, you know, um, even though I know you're going through it, I'm going through it too. I don't want to really do anything right now with exercising, but we have to continue it because we have to keep something normal that we do on our day-to-day basis, or we'll go crazy. Because I can feel it in my body. We've been around each other for so long now, and even before that, we were talking to each other every day. So we were connected for so long, for what, almost 5 years now, to where she's stressful. I can feel it, and I'm sure you know what I'm talking about, Big O, and also you too, Homer. When your wife is going through it, you go through it with them. So, and then also seeing her family go through it, it's like all the pressure goes on you, and then you're not exercising. I haven't exercised in a day and a half. Um, it just gets to you. It gets to you. Oh man, my body's not feeling right. But thank you guys for listening to me ramble on right now. It's good. It's good sometimes to get it out. And also get out a positive message as well. I seen Sheree said that she had cancer, and her changing up her diet helped kill her cancer. And that's the thing that does it. These doctors, they try to put you on these medicines, and they try to put you on these pills, and then they put radiation in your body, which actually kills your body more. That's why people lose their hair. That doesn't really help fight the cancer. It'll kill the cancer, yeah, but it'll kill you too. You know, it's like people say, you know what will kill AIDS, and it's made as a joke, but it's true. Bleach, but it'll kill you too. So what's the whole point of taking a bleach? That's what radiation is like. Oh, you have a foundation to raise ovarian and gynecological cancer. Oh yes, I would definitely check it out. You can drop the name of your foundation here. You know, yeah, you can definitely leave the name of your foundation here. That's not a problem. I'd love to take a look at it and see what you're doing. That's great. You know, or even maybe even uh, speak at one of your events if you ever have an event or something like that. Gosh, sure, I would definitely love to do that. But yeah, I'm gonna work soon. I still have to work. Yeah, home. I didn't see the full thing and Big O2. Um, I didn't see it in full. But yeah, that's sure right. That yeah, that's what I'm. You could definitely volunteer with that. I'm looking to change it around and stop just I don't want to just give the people food. I want to meet with them and also find out the needs of their health and put them on diets when I give them food. You get what I'm saying? And then we can work on them with ways to get their own food. But it's just to really change their mind state and the way they're living. Because believe it or not, a lot of people here, what people got to understand is, I realize this, with people that don't eat that much. With people that don't eat that much, it's good that they're not eating that much because it's healthy. If someone doesn't eat for 2 days, that's giving their body 2 days to clean out all the toxins they put in their body. You know, exactly, Big O. Exactly, and that's why I'm trying to make those changes now myself. We need to change, and you have to see it, and that's what I'm saying about the people that live on the streets. A lot of these people, yeah, they're malnourished because they're not getting the right vitamins. So that's why I felt, you know what, I'll give them the fruits and vegetables. But they need to learn, and also a lot of them, what takes up for the malnourishment a little bit is that they're fasting. Their body is cleansing itself out and healing itself. Because the real reason why you need to fast is so your body can heal itself. Your body can't heal itself if you're eating 2, 3 times a day. You know, your stomach needs to be clear, a clean colon. Right now my colon is I'm sure still dirty. You know, yeah, we definitely appreciate your prayers, Miss Harris. But it's things like that. It's just yeah, detox exactly. It's kind of like you're detoxing every day, not really detoxing, but you clean your body out every day. You're giving your body enough time. At least 16 hours you want to give your body. At least 16 hours to get all of the junk out you just ate the day before. And believe it or not, when you do that, you're actually better off than some people that eat healthy and eat 3 times a day because they're not giving their body enough time to heal itself. That's the trick with fasting. Sometimes you can find a person that's fasting that's eating garbage is healthier than a person that's healthy eating 3 times a day because they're not giving their body time to heal. So it's things like that that people need to understand and you know maybe I'm thinking, man, maybe when I start seeing people like these yes, thank you, Fossil Jet. Yeah, that's right. Once we get used to it, our body will ask for it. That's true, kid. And that's what it is. That's what I think. It's more than just the people in poverty that need your help. I think it's the whole world, man. I think it's the whole world. We're actually, if you're poor in mind and body, then you're poor right there. I believe you're more poor than that person sleeping on the street, and that's just facts. You know. So this right here is a wake up call, a big wake up call. to make sure I'm more prepared financially, health, spiritually. Everything needs to be in center, and I suggest that for you guys out there too. Um, don't just think about coming to the Philippines and getting with pretty Filipinas. Um, you know, drinking and that's all you do. Think about changing your life. What can I do to better myself? What can I do to better someone else while I'm here? Or even in your home country. You don't have to be in the Philippines. You can be anywhere in the world. What are you gonna do to better yourself to help someone else out? That's what it's about. And I wanted to talk about insurance, and I did, but it went from talking about insurance to talking about everything pretty much. But that's just how I feel right now. But it starts with us, and it starts with the people around us. So, me and Kay have a lot of work to do as far as talking our families and everything. You know, but we're gonna work on ourselves first. That's the immediate thing, getting ourselves right because you can't be out there telling people to do it and you're not doing it. So that's why we're working on us right now. And guys, I'm going through everything. I'm still on uh, with Kay and I'm still on slave duty. So I appreciate you guys for stopping by. I gotta still, unfortunately, go work and get paid. So see you guys later. Thank you. I still don't have a regular schedule on lives yet. I'm not gonna have a regular schedule on lives anytime soon. Um, I don't even have a regular schedule with videos. But I am looking to work on Monday, Wednesday, and Friday. I was gonna do that this week. I was gonna have it set, but then this happened. But I was gonna have a schedule set for making my videos this week. But who knows? Maybe in 2 weeks or 3 weeks, I have everything set to where you guys know when fitness, diet, Philippines videos are coming. I will try to make sure those Philippines videos are interesting, showing you guys what's going on out here. Uh, yes, on your news, you came at the end. You came at the end. But yeah, you can still check it out. The video is gonna be live. And thank you guys for stopping by and showing love. I appreciate it. All right, later.